Welcome, I am Terry Tropin, and today I'll be discussing how to use the ICD-10-PCS Index. But first, let me tell you a little bit about myself. I have a Master's in Healthcare Administration Informatics from the University of Maryland Global Campus. I have an RHIA and CCSP certifications. I'm also an AHIMA-approved ICD-10 trainer. I taught health information technology at Montgomery College for over 20 years and recently retired. I've also written books on coding. These books are study guides that summarize the coding guidelines. They take the confusing guidelines, translate them into regular, normal English, and place them in tables for easy reference. My books include one on evaluation and management coding, one on diagnosis coding, and one on PCS coding. These books are available on Amazon and updated every year or as needed. If you would like to purchase a copy of these slides for this video, give me a thanks of $5 or more and comment with your email address. The thanks is down here. I will then send you a PDF of the slides. Click on the thanks button under this video. Okay, so this is what I'm going to talk about today. I'm going to talk about the guidelines for using the index, the format of the index, how the index entries are set up, how to select the root operation, and special considerations for endoscopic procedures and suture removal. Also going to talk about drugs and drug substances, finding those in the index. Also going to talk about two appendices, Appendix B and Appendix J. These can be very helpful in finding something in the index. And there are also some other appendices that I will discuss briefly. Okay, the ICD-10 alphabetic index is an alphabetic order, of course, but it's based on the type of procedure performed, the root operation generally, excision, resection, transplantation, etc. In most cases, the index lists only the first 3 to 4 characters of a code. That means you must look for the tables for the remaining digits. You remember that each code has to have 7 digits, 7 characters. Okay, so the first 3 digits would be these 3, the section, the body system, and the root operation. Now, the root operation is generally how it's listed in the index, but after the subterm, you'll have these 3 digits listed. So here are some guidelines on using the index. This is guideline A6. The purpose of the alphabetic index is to locate the appropriate table that contains all information necessary to construct a procedure code. The PCS table should always be consulted to find the most appropriate valid code. Again, that means that you have to have 7 digits. On some occasions, there'll be all 7 digits in the index, but even if that happens, you should still go to the table to double check and make sure you have the right information. Sometimes that can be tricky, and I'll give some examples of when that is tricky. Okay, here's another guideline. This is guideline A7. It is not required to consult the index first before proceeding to the tables to complete the code. A valid code may be chosen directly from the tables. So if you know where you need to go, you can go right to the table. Now here's a good example. The obstetric section, which begins with the digit 1, includes only 12 possible tables. The root operations are fairly straightforward: abortion, delivery. We know what those mean. So if you want to go straight to the obstetric section and look at those tables, that's fine. In fact, I think going to the index to look for obstetrics can make it more confusing rather than less. So you need to go to the tables, absolutely, but you don't necessarily need to go to the index. Okay, so this is what the index looks like. For the medical and surgical related sections, the main terms are the root operations. Here you have release, and then indented under that, a general body system, bursa and ligaments, and then indented under that specific body parts of the abdomen, ankle, elbow, etc. And then listed under the specific body part are more specific terms, and then finally the code. So you have ankle left, 0 MNR, ankle right, 0 MNQ. So these include the first characters 0 through 9. That's for the medical and surgical section. The index also includes main terms for the ancillary sections B through H. These use type of procedure, not root operations, as the main terms. So for example, let's look at administration. It says see transfusion and introduction. So this has the main term for the ancillary section and for the specific section for administration, and then gives you additional information. Some main terms do not refer to a specific code, but use a C reference. So here we see adenoidectomy, C excision, C resection. So excision 0 CBQ, resection adenoids 0 CTQ. So these use, instead of the root operation, the excision or resection, it gives the common procedure, in this case, adenoidectomy. It's also true of appendectomy and fundoplication. So these terms are listed, but they give you a C reference, excision or resection in this case. Now, this gives you enough information, this adenoidectomy, for example, gives you enough information that you don't necessarily have to go back to excision adenoids. You can go to table 0CBQ or 0CTQ to find the rest of the code. So it says C, but you don't really have to go back and find that in the index. Now, the other reference is a use reference. This refers you to a different anatomical site. So see the abductor hallucis. It says C muscle foot left, C muscle foot right. So if all you have is this muscle, you can look that up and it will tell you what is used for this. Now note that these do not give you enough information to go to a table. So you need to go to the reference muscle foot right, muscle foot left in order to find the correct first couple of digits. So the guidelines say that these references act as an additional reference to terms located in the appendices. The term provides the body part value or device value to be selected, so it refers you to where you need to go. It's not intended to direct you to the table, it's intended to direct you elsewhere in the index. Now, the main terms, as I said, are generally root operations. Note that there are no indented terms for what actually may be the focus of the procedure. So if you're looking for an excision of a lesion in the small intestine, you're going to look at excision small intestine. Okay, so you're looking for part of the small intestine, the part of the small intestine that includes the lesion, the polyp, the tumor, the scar, whatever. So you're not going to find the lesion, you're going to find the body part only. So that can be kind of confusing. Some of the main terms and indented terms can be confusing, particularly if you're used to finding terms in the ICD-10-CM alphabetic index. For example, under the term extirpation, you have indents for common iliac, external iliac, and internal iliac. Now, you might expect extirpation, iliac, and then indented under that, common, external, internal. But that's not how this works. So alphabetically, it's extirpation, common iliac, external iliac, internal iliac. Okay, so that's kind of confusing. Also for infusion, you can see different main terms: infusion, infusion device, infusion, glucarpidase. And also there's different main terms for repair and repair obstetric laceration. So this kind of gets some, takes some getting used to, but that's how this is built, how this is made up. So here's some more examples of confusing main entries. So you have different main term entries in the index for change device in, and then a separate one for change device in or on. Now, some of the ones in change device in are also in change device in or on, but some are not. So you might want to circle these in your index so you realize that there's two different entries where you might be looking. There's also main terms for insertion and insertion of device in. Separate entries that you need to be sure and check both to make sure you get the right term, the right first digits to refer you to a table. There's also separate entries for revision and revision of device in, and also removal and removal of device in. So these are separate main terms that if you look up just removal, you may miss something. If you look up just revision, you may miss something. There are also separate main entries for suture and suture removal. Luckily, these are right next to each other, but still they could be missed. So suture refers you to laceration, repair, see repair. For suture removal, that is listed. That actually gives you the whole code. That's unusual. If you look up suture, wound to abdominal wall, it refers you to repair abdominal wall. And again, it gives you enough information that you can go right to the table from there. You don't need to go to repair. If you have suture removal of the trunk, which is where the abdominal wall is, it gives you the complete code. This is in other procedures section 8, not in the medical and surgical section. But again, make sure and go to the code, look at the table, look at all the digits, and make sure you have the right one, because it seems obvious, but particularly when you're just starting out, it's important to check it. Now, a drug or substance may or may not be listed in the index, okay? So sometimes the drug will have its own main term entry, but sometimes it will not. So here's an example. Remdesivir severe has its own entry, XW0, in the new technologies section. If you look up blinatumomab, it refers you to other antineoplastics. So when you look up the table for introduction or whatever, and then you would use the other antineoplastic, meaning it doesn't have its own entry, its own specific entry for this specific substance. So if it's not in the index, what do? Well, look for route operations for how it's been administered. Is it an introduction? Is it an infusion? Is it administration? Look under that main term in the index rather than the specific drug. But sometimes the drug will be there and sometimes it won't. So this can be confusing. As stated before, the code should reflect the reason or the goal of the procedure. Why is the provider doing this? What is he or she trying to accomplish? This is the root operation. So this can be confusing, and a good example of this is endoscopy procedures and dilation and curettage. So let's look at those. Endoscopy procedures. Sometimes the endoscopy is the purpose of the procedure, meaning the provisor is looking around an area to determine what is causing a problem. This is used for exploratory procedure. The procedure is looking around and not performing another procedure. This is coded as an inspection. So the point of this is looking around, inspecting the area. Now, sometimes a provider is performing a procedure and an endoscope is the approach used. So the endoscopy is not the reason it's being done, it's just the means for performing it. In that case, you're going to use whatever is the appropriate root operation, the approach, the reason that the procedure is being done. And then you're going to use the endoscopy just as the approach digit. So you have percutaneous endoscopic, via natural artificial opening endoscopic, or via natural or artificial opening with endoscopic assistance. So it depends on what is the point. Is the endoscopy the point, or is the endoscopy just the way to do what they're trying to do? So here's an example. It's often best to understand these by just using an example. So the physician performed an exploratory diagnostic esophagogastroscopy. No other procedure was performed. In the index, find esophagoscopy 0DJ08ZZ. This is an inspection. And notice that the root operation in this case is inspection. Okay. So this is true for, in this case, an EGD, an esophageal gastroscopy, an EGD, arthroscopy, angioscopy, laryngoscopy, hysteroscopy, nephroscopy. Other kinds of scopies can be either the point of the operation or the means to perform the point of the operation. So let's look at another example. This is for a D&C, a dilation and curettage, which is diagnostic. Okay, so they're taking some scrapings from the endometrium to diagnose what the problem is. This is 0UDB8ZX. So this is an extraction. The purpose of the procedure is not the hysteroscopy. The purpose of the procedure, why it is being done, is extraction of the tissue. Okay, so in this case, the hysteroscopy is the approach via natural artificial opening, which is 8. So if you look up dilation, cervix, you get 0U7C. But the point is not the dilation. The point is what's needed. The dilation is what's needed in order to do the extraction of the tissue from the endometrium. The dilation just facilitates the extraction. If you look up curettage, which of course is the goal of this procedure, you're referred to excision and extraction. So which is this, excision or extraction? You can go to Appendix B and you will see a definition of excision and extraction. But most importantly, you will see that a D&C is listed as an example of the root operation extraction. We'll discuss this more about Appendix B in a minute, but this is so important where you have examples. I think having examples of how each root operation could be used is very helpful. In fact, when you find something that you found confusing, you can write it into that appendix. And then next time you'll go, oh yes, that was a such and such. So this is very helpful. So the point of the procedure was the curettage, not the dilation, not the hysteroscopy. So sometimes you have to kind of think through what the procedure was in order to figure this out. So sometimes, if you're lucky, you can refer directly to the index. You can go to the index, get the first digits, boom, go to the table, and you got it. Sometimes it's not so easy and you need to use the appendices first, and I'm going to give some examples of these. If you're lucky, you can go right to the index, find the term, and go to the table. So here's an example. Packing of wound in the chest cavity. So the main term is packing. In this case, terrific, you get all 7 digits in the index, but you're going to turn to the table anyway to double check the root operation. Now, sometimes the index will give you 6 digits, not 7. And so if you're in a hurry, you'll say, oh, great, I've got the whole code, and just put that down. Remember, you have to have 7 digits. So make sure you have 7 digits and not just 6 from the index, and you just put those down. That can be also confusing. So here's another example. Exploratory arthrotomy of the left knee. So the main term in the index is drainage, is arthrotomy. You have drainage lower joints, drainage upper joints. So the knee obviously is the lower joint, so you're going to use 0S9D0ZZ. So this gives you the first 3 digits, which is enough to go to the tables. Okay, Appendix B. Unfortunately, it's not as straightforward and easy as it was in the previous examples. Sometimes you need to go to Appendix B, root operation definitions. This is a very important, very helpful appendix. It gives you a definition of the root operation, a little explanation of it, and most importantly, examples. So here's an example: restriction, which is V. Definition: partially closing an orifice or lumen of a tubular body part. Now, if you need to write in what an orifice is and what a lumen is, this is the place to do it. Explanation: the orifice can be, an opening can be a natural orifice and an artificially created orifice, meaning down the throat, it's a natural opening, or artificially created orifice like a tracheostomy, okay? And it gives examples: esophagogastric fundoplication and cervical cerclage. So it gives a lot of good examples to really help clarify this. So this is a very helpful index. So it includes definitions. Appendix B includes definitions for medical and surgical section, obstetrics, placement, administration, measurement, monitoring, extracorporeal, osteopathic, other procedures, and chiropractic. So each of these sections are listed in separate tables. Now, some of the table overlap. Obstetrics uses some of the same root operations as medical and surgical, but they're each separate and listed in separate tables. So here's an example of using Appendix B. So we're trying to look for a partial resection of the pancreas, open approach. Okay, what's the difference between resection and excision? What do I need to look up? Excision or rescission? Excision is portion of a body part. Resection is all of a body part. So you can look that up into Appendix B, look at those definitions, and you can see, okay, this is partial resection, so that's actually coded as an excision, because of course the physician won't necessarily use the terminology that PCS uses, so you have to think about it. So partial resection, that would be an excision, so the term you look up in the index would be excision. Excision, pancreas, 0FBG, and so you turn to the table, remember, always turn to the table, and you get 0FBG0ZZ. Okay, so there's also an Appendix J. Appendix J is for the ancillary sections, character definitions. Now, these don't use the term root operation, but they use the term type of procedure. So Appendix J defines the terms used in characters 3, 4, and 5 for imaging, nuclear medicine, physical rehabilitation, diagnostic audiology, mental health, and substance abuse treatment. Now, it's interesting there's no definitions for Section D, radiation therapy, in here. First, let's look at Appendix J and definitions for imaging procedures. These are the character 3, the type of procedure. equivalent to the root operation, but type of procedure. Computerized tomography, fluoroscopy, magnetic resonant imaging, other imaging, plain radiology, and ultrasonography. So plain radiology includes X-rays. If you look up X-rays in your index, it will refer you to plain radiology. So in the index, if you look up imaging diagnostic, it will refer you to the different types of imaging procedures. So what you really do is just look up the type of imaging, look up the CT, the fluoroscopy, the MRI, whatever in the index, and that will give you the correct type, and then you find the body part indented under it. Okay, now let's look at the definitions of nuclear medicine procedures. These are in section C. It has definitions for the character type. Again, this is the procedure type. Again, this is character 3, non-imaging nuclear medicine assay, non-imaging nuclear medicine probe, uptake, planar nuclear medicine imaging, positron emission tomography, systemic nuclear medicine, and tomographic nuclear medicine imaging. So these all are in there, and these are there as main terms in the index. So if you look up tomographic nuclear medicine imaging, that will be in the index. So let's look at the difference between imaging, nuclear medicine, and radiation therapy. So this is in imaging, you have plain radiography, which is X-rays, fluoroscopy, CT scan, MRI, ultrasonography, and other imaging. In nuclear medicine, you have some that are imaging procedures and some that are not imaging procedures. And then in radiation therapy, you have beam radiation, brachytherapy, stereotactic radiosurgery, and other radiation. So these can be kind of confusing, but they're very specific. Okay, also in Appendix J includes definitions of terms for physical rehabilitation and diagnostic audiology. Now, this is a very large section because there's a lot of things in this one section. So it has definitions of character 3, the type, such as activities of daily living assessment, measurement of functional level for activities of daily living, bathing, dressing, cooking, things like that. It also has definitions of character 5, the type qualifier, motor treatment, exercise or activities to increase or facilitate motor function. So what's in the index? The character 3 type are in the main index, but if you're not sure which one to use, you can go to Appendix G and that will help figure it out. Appendix J also includes definitions for character 3 in the mental health section. So you have definitions, you have biofeedback, counseling, crisis intervention, electric convulsive therapy, family psychotherapy, group psychotherapy, hypnosis, individual psychotherapy, light therapy, medication management, narcosynthesis, and psychological tests. So these are all defined in here. These terms here these are main terms in the index. So once you figure out which one it is, you can look up that term in the index, and that will give you to the code. Appendix J also includes definitions of character 4, the qualifier value in the mental health section. I don't know about your CPT books, but in my book, which is AMA's book, the heading dividing character 3 and character 4 definitions was omitted. It's in the previous version, the 2021 version, but not in my 2022 version. Maybe you have that, I don't know, mine doesn't. So the heading should be after psychological testing and before behavioral, the difference between character 3 and character 4. So these are definitions for character 4, the qualifier values. These are not in the index. You have behavioral, cognitive, behavioral, developmental, intellectual and psychoeducational, interactive, interpersonal, neurobehavioral and cognitive, neurophysiological, personality behavior, psychoanalysis, psychodynamics, psychophysiology, supportive, and vocational. These are all character 4s. The ones that are in the index are the character 3s. Okay, also, finally, Appendix J includes definitions for character 3 type for substance abuse treatment. These terms are in the index. You have detoxification, family counseling, group counseling, individual psychotherapy, medication management, and pharmacotherapy. So these are all main terms. Now, your PCS book also includes other appendices which define device and substance characters, which are characters 6 and 7 in a code. Some of these are listed in the index. For example, the devices listed in Appendix G. For example, if you see artificial anal sphincter, that's also listed in the index. So you have Appendix F, device classification, Appendix G, device key and aggregation table, Appendix H, device definitions, Appendix I, substance key, substance definition. And we talked a little bit about that before, that sometimes the substance is listed separately and sometimes it's not. For example, nafamostat, anticoagulant, is listed in the index and also in Appendix I. Now, Appendix I also lists the trade name. Okay, so let's summarize. How do you look up a procedure? So think, first of all, what is the goal? Why is this being done? What is the purpose? Remember what we talked about with hysteroscopy, D and C. The hysteroscopy was not the point. The dilation was not the point. The point was the curettage. So sometimes you have to kind of think about what the procedure actually is. So then you find the root operation or the procedure in the index and use those appendices. Those are so valuable, particularly the definitions of root operations. It can be so helpful, particularly when you're just beginning. And that will help you determine the root operation type of procedure as you need to. Remember, never, ever, ever code only from the index. Take the digits from the index, excuse me, and go to the correct table, even if you have all 7 digits listed in the index. So then you go to the table, and then when you go to the table, at the very top of the table, it again defines the root operation. So just kind of glance at that to make sure that it fits for that specific case. Just kind of reconfirm that that's the correct root operation. And again, be sure to use all 7 characters. So it's impossible to remember all these guidelines, and it's very easy to get confused. So here's some suggestions to write for notes in your CPT, your ICD-10 PCS book to help you remember the guidelines. Find terms such as esophagogastroscopy, arthroscopy. They give you that root operation J inspection and write in inspection only. That way when you go to that, you won't go, great, here's the whole code, and just write it down. A lot of students have done that, and it's wrong. It may very well not be correct. So in the Appendix B, you can also go to the root operation, underline keywords like excision is a portion of a body part, resection is all of a body part. That way it's easy to see the difference between the two. You don't have to read all the information there. You can say, okay, excision is portion, resection is all. And then as you work through cases or quiz questions or whatever, write in examples of specific root operations in that Appendix B, the things that you find confusing, okay? In Appendix J, in the definitions for mental health, if your book is like mine and that heading is missing, draw a line between psychological tests and behavioral. And at behavioral, write in character 4. The ones above that are for character 3. The ones below that are for character 4. Okay, that completes the video. If you have questions or comments, please feel free to contact me. Here I am right here. If you'd like to purchase a copy of these slides, give me a thanks of $5 or more and comment with your email address, and I will send you a PDF of the slides as a thank you. I appreciate you all listening very much. If you enjoyed this video, please give it a like and subscribe by clicking on the picture of me in the lower right-hand corner. So here again are the books that I have written on coding. They're available on Amazon, and here is the link to that right there. You can also just go to Amazon Books and type in TROPIN, and that will get you to the books. Thank you so much for listening. I really appreciate it. Thank you.